Every 66 seconds, another American senior receives a dementia diagnosis. By the time this video ends, 20 more families will have sat in a doctor's office and heard those words. And here's what nobody is telling them. For a significant number of those people, the cause isn't their age. It's a pill sitting on their bathroom shelf, a pill their doctor prescribed, a pill the pharmacy filled without a single warning. Someone who was sharp their entire life starts losing the thread, names, appointments, the drive home they've made 1,000 times. And everyone around them says it's just getting old. It wasn't. In case after case, it was a medication, and nobody thought to question it. Before we go any further, do me a favor. Subscribe right here to the Dr. Weston channel and tap that like. It takes 5 seconds and it genuinely makes a difference. We're pushing toward 10,000 subscribers, and this channel exists for one reason: to tell you what your own doctor doesn't have time to explain in a 7-minute appointment. I'm Dr. Weston, and for 15 years I've watched families sit across from me describing a loved one who started losing their sharpness, their clarity, their sense of direction, and every single person around them called it aging. In most of those cases, it wasn't. It was a medication, and nobody had thought to question it because a doctor prescribed it and a pharmacist filled it. The pharmaceutical industry doesn't send you a bill for the cognitive decline it helped cause. That's exactly why this conversation needs to happen here. Today I'm walking you through the 9 medications most closely tied to accelerated memory loss in older adults. We're counting down from 9 to 1, and the ones that sound the most harmless are often the worst offenders. Pay close attention to number 3. It is handed to millions of Americans for something that sounds completely benign, and it may be quietly shrinking the memory centers of your brain right now without a single warning sign. Let's go. Number 9. And don't let the low ranking fool you. This one is sitting in almost every medicine cabinet across this country. Number 9 is Diphenhydramine. You know it as Benadryl, the little pink pill people reach for to fall asleep, knock out an allergy, or get through a rough cold. It costs a few dollars at CVS or Walgreens. It sits right on an open shelf, no prescription needed. And that's exactly why most people never think twice about it. If you don't need a script for it, how dangerous could it really be? Here's what's happening inside your brain when you take it. Benadryl belongs to a class of drugs called anticholinergics. That's a $10 word for a simple idea. These drugs block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to lay down a new memory and stay alert through the day. Think of it like the electrical current that keeps your kitchen lights on. Now here's the problem. As we age, the brain naturally produces less of it. It's already working with a smaller reserve. So when you introduce a drug that blocks what little is left, the effect lands far harder on a 70-year-old brain than on a 30-year-old one. The structure that takes the hardest hit is the hippocampus, a small, curved structure deep in the brain, roughly the size and shape of a seahorse, where new memories are formed before they get filed away. When acetylcholine drops, that's the first thing to go dim. In my practice, I've had patients take a nightly antihistamine for years and slowly lose their mental edge, never once connecting the fog to that pink pill on the nightstand. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with those who didn't take them. More than half again the normal risk, from something most of us treat like a piece of candy. Here's what I want you to do right now. Read the label on anything you take to help you sleep, and anything labeled PM, nighttime, or allergy relief. Those are very often just Benadryl wearing a different name. If you're taking it for allergies, newer antihistamines like loratadine, sold as Claritin, don't cross the blood-brain barrier the way Benadryl does, and are a far safer long-term option. Never stop a medication on your own. Bring it to your doctor. But stop assuming that over-the-counter means safe for your memory. That's number 9. Number 8 is a drug your stomach loves and your brain quietly pays for. Number 8 is proton pump inhibitors. You know them by names like omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications shut down acid production in the stomach. They get prescribed and handed out without prescriptions for heartburn, acid reflux, and that burning sensation after a big meal. And they work. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring right back. So it feels like the drug is the only thing holding the line. Here's the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food, and chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Suppress that acid far enough, for long enough, and your B12 quietly drops. So do magnesium and calcium, two minerals your brain cells depend on to fire and signal cleanly. Starve those neurons long enough, and you get misfires, mental confusion, and memory slips that look exactly like early Alzheimer's, when the real cause is a nutritional deficiency your medication has been creating all along. In 2016, a large study in JAMA Neurology examined more than 73,000 people aged 75 and older. Regular PPI users had a 44% higher risk of dementia compared to those who didn't take them. And it goes even deeper than nutrients. PPIs have also been shown to raise levels of amyloid beta in the brain, the same sticky protein that builds up in Alzheimer's disease. If you take a PPI every single day, that is the conversation to have with your doctor. Many people can step down to a gentler class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your cognition. Deglycyrrhizonated licorice, a natural compound that coats and soothes the stomach lining, can ease reflux symptoms without any cost to the brain. The goal should always be the lowest effective dose for the shortest necessary time, not a pill you take forever out of habit. Number 7 is prescribed for a problem most Americans would rather not talk about. Number 7 is bladder medications, and the one to know by name is Oxybutynin, sold as Ditropan. It's given to seniors dealing with that sudden, urgent, can't-wait need to get to the bathroom. Overactive bladder affects millions of older Americans, and it can reorganize an entire day around the fear of not making it in time. The relief this medication provides is real. The embarrassment it spares people, real. But here's what doesn't get explained at the prescribing visit. Oxybutynin works by blocking acetylcholine, the same memory chemical we talked about with Benadryl. And this particular drug has an unusually easy time crossing into the brain and settling right where memories are made. That makes it one of the more concerning medications on this entire list for older adults, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of adults over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, nearly 1 in 2, and almost none of them were warned. Let me tell you about a patient I'll call Linda. Linda was 68 years old when her daughter first called me. Retired elementary school teacher from outside Columbus, Ohio. Sharpest woman in any room she walked into, raised 3 kids, ran a classroom for 32 years, never missed a beat. About 2 years before I saw her, her urologist had started her on oxybutynin. It helped her bladder immediately, but within 6 months, her daughter noticed something wrong. Linda was forgetting conversations, showing up to lunch appointments a day early, getting lost in parking lots she'd used for years. The family was quietly bracing for Alzheimer's. I pulled her medication list. The oxybutynin had been running for 18 months. We worked with her urologist to switch her to mirabegron, sold as Myrbetriq, which works through a completely different pathway and doesn't touch acetylcholine at all. Within 8 weeks, Linda told me the fog had lifted. Within 4 months, her daughter called to say Mom was back. That story is not rare. It happens every day in this country, and most of the time, nobody connects the dots. If you take oxybutynin and you've noticed your memory slipping, take that seriously. You do not have to choose between your bladder and your brain. Bring it up at your next visit. Now, before we keep going, how old are you? Drop your age in the comments right now. I want to know exactly who's watching, because the risk from these medications increases sharply after 60, and the age breakdown in the comments shapes what I cover in future videos. Number 6 might be the most surprising one on this list, because it is one of the most prescribed medications on Earth. Number 6 is statins. Simvastatin, sold as Zocor, atorvastatin, sold as Lipitor. These are among the most widely prescribed medicines in the world, especially after age 60. And they do an important job, lowering LDL cholesterol and reducing the risk of heart attack and stroke. Statins belong in a lot of people's lives, and this is not a case against them. What follows is the half of the story that almost never gets told. Here's what most people don't know. Cholesterol is not just a heart issue. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath. Think of that as the rubber insulation wrapped around electrical wiring in your house. Without that insulation, signals don't travel fast or clean. Lower cholesterol aggressively enough with a high-dose statin, and you can leave the brain short of a raw material it actually needs to function. The statins that cause the most concern are the ones that cross readily into brain tissue. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. And the higher the dose, the steeper the decline. Some patients describe frightening blanks, a familiar name suddenly gone, a conversation they just finished completely erased, a route they've driven for 20 years suddenly unfamiliar. Pay attention here. This is where most conversations about statins go wrong. Not every statin affects the brain the same way. Pravastatin and rosuvastatin don't cross into brain tissue as readily and are generally considered safer choices when it comes to preserving cognitive function. If you've been on a statin for years and you're noticing creeping forgetfulness or mental fog, that is a real conversation to have with your doctor about the dose, about the specific drug, about whether a switch makes sense. Do not quietly stop a medication that may be protecting your heart. Get the plan right with professional guidance. Number 5 is in more nightstands and medicine cabinets than most people realize. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most commonly prescribed medications in America for anxiety and sleep problems. And for good reason. They work by boosting GABA, the brain's natural quieting signal that turns down an overactive nervous system. At first, they feel like a rescue. The panic eases, the racing thoughts slow, sleep finally comes. But over time, the picture changes. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting ones like diazepam appeared even more problematic because they stay in the body longer and accumulate in fatty tissue, including brain tissue. What these medications do over time is create a slow, quiet chemical sedation of the entire brain. Learning slows, mental flexibility decreases. Many people describe a kind of emotional flatness, like they're moving through a haze and no longer feel entirely like themselves. And here's the cruelest part. If you stop a benzodiazepine abruptly, anxiety and insomnia often come back with far greater intensity, sometimes with dangerous agitation. That makes the medication feel absolutely essential at precisely the moment it may be causing the most harm. So here is the rule, and it matters. If you've been taking a benzodiazepine for more than a few weeks, do not stop suddenly. That can be life-threatening. Work closely with your doctor to taper down gradually over weeks or even months. There are gentler options. Buspirone can help with anxiety without causing sedation or cognitive clouding. Specialized therapy approaches for insomnia and anxiety have strong track records and carry no cognitive cost at all. Number 4 is a single medication prescribed for 3 different problems, and it carries one of the heaviest hidden burdens on this entire list. Number 4 is Amitriptyline, sold as Elavil. It's an older antidepressant still widely prescribed today for nerve pain, sleep difficulty, and even migraine prevention. That versatility is exactly why it became so widespread. It looks like one medication that can solve 3 problems. But beneath the surface, it is one of the most powerfully anticholinergic drugs still in everyday use, meaning it blocks acetylcholine, the memory chemical, more aggressively than almost anything else on this countdown. This is the most important section of this entire video. Listen closely. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults 65 and older. Those with the highest cumulative exposure to anticholinergic drugs, Amitriptyline among them, over a 10-year period had a 54% greater risk of developing dementia. And the vast majority of them were never warned. They were given it for sleep or pain, then gradually noticed words slipping away, memories thinning, concentration weakening, and they assumed it was age. It wasn't. And it doesn't require a high dose. A small nightly amount taken for years can quietly erode cognitive function without a single obvious warning sign until the loss becomes significant. If you or someone you love takes amitriptyline, that conversation is worth having soon. For nerve pain, options like duloxetine or gabapentin may provide comparable relief without the same burden on the brain. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may work as alternatives. For mood, newer antidepressants like sertraline or escitalopram are generally considered far safer for long-term brain health. Number 3 is the one I told you to watch for. Number 3 is paroxetine, sold as Paxil. It's one of the most widely prescribed members of a drug family called SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. And for most people, that reputation holds. Here's the detail that is almost never discussed. Paroxetine is the one SSRI with significant anticholinergic activity. That single characteristic sets it apart from its close relatives, sertraline, escitalopram, because it disrupts the same acetylcholine system that every other medication on this countdown has been attacking. You're taking a drug for your mood, and it's quietly working against your memory at the same time. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users showed measurable declines in short-term memory, word recall, and sustained attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There's a painful irony there. You take the medication to stabilize your mind, and over time, it may be quietly eroding the very clarity it was meant to protect. The solution here is straightforward. In older adults, paroxetine is generally a medication worth reconsidering when alternatives exist. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, for exactly these reasons. If you take it, speak with your doctor about switching to sertraline or escitalopram, which don't carry the same cognitive concerns. Supporting healthy B vitamin levels, especially B12 and B6, can also help support mood through that kind of transition. Number 2 concerns me deeply because many people taking these drugs never knowingly agreed to take an antipsychotic. Number 2 is antipsychotic medications. The names: quetiapine, sold as Seroquel; risperidone, sold as Risperdal; olanzapine, sold as Zyprexa. These were developed for serious psychiatric conditions, schizophrenia, bipolar disorder, and they have a real, legitimate place in medicine when those conditions are present. But today they are frequently prescribed off-label to older adults for sleep problems, mild restlessness, or agitation associated with dementia. Powerful medications designed for severe psychiatric illness are now commonly used in homes and nursing facilities for seniors who are confused, hard to settle, or simply difficult to manage in a busy care environment. The cost can be severe. In 2022, a study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even when they had no prior history of dementia before treatment. These medications also raise the risk of stroke, sudden cardiac events, and the profound sedation that contributes to falls and hospitalizations. They suppress dopamine, a chemical involved not only in mood, but in focus, planning, and memory. Reduce dopamine enough, and the brain becomes slower, less responsive. Some individuals taking these medications appear emotionally flat, dull, almost absent, while their families grieve the slow disappearance of someone who is still physically in the room. If you or a loved one is on one of these medications, the first step is to ask the prescribing physician directly, why was this started and is it truly necessary? Many behavioral symptoms respond well without any medication at all. Consistent daily routines, reduced noise and overstimulation, identifying and treating hidden pain, improving sleep, and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration significantly reduces the risk. Far too often, families are never told what these drugs can do to the brain. They watch a decline they believe is inevitable when the true cause may be chemical and potentially reversible. Now we arrive at number one, and number one is not a single medication at all. It may be the biggest hidden driver behind every story I've shared today. Number one is anticholinergic polypharmacy. I know you were probably expecting one final villain, one worst pill. The reality is more subtle and more dangerous. The greatest risk often comes not from any single medication, but from the slow accumulation of multiple anticholinergic drugs taken together while nobody adds up the total burden. Here's what I mean. Polypharmacy means taking several medications simultaneously. Anticholinergic burden refers to the combined effect of all those medications blocking the same memory-related chemical at the same time. Different drugs, same target, stacking on top of each other with no one doing the math. Think about this common scenario. A senior takes Benadryl every night for sleep, Oxybutynin every day for bladder control, Amitriptyline every evening for nerve pain. Individually, each medication may produce only a small, barely noticeable effect. Together, those effects compound. The burden on the brain rises rapidly. And nobody, not the prescribing doctors, not the pharmacist, not the patient, has sat down to calculate the total. In 2022, a study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double. And the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. When acetylcholine is being blocked from multiple directions simultaneously, the brain doesn't simply slow down. Neurons can begin to weaken from underuse. Connections may shrink. The brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. That's the part that breaks my heart. People receiving an Alzheimer's diagnosis when the true cause is sitting in their medicine cabinet. Here is the hopeful part, and it is the reason I made this video. Medication-induced cognitive decline is often reversible when it's identified early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than most people realize, but only when the source of the harm is removed. The solution doesn't require a miracle. It requires a careful medication review. Sit down with your doctor or your pharmacist and go through every prescription drug, every over-the-counter product, every supplement you take. All of it. Ask specifically about the total anticholinergic burden. Write those words down before your next visit. Scoring tools exist that can help identify that risk. Once the problematic medications are found, unnecessary drugs can be reduced or discontinued under medical supervision, safer alternatives can be introduced, and the brain can be given a genuine chance to recover. This may be the most preventable form of cognitive decline on this entire list. That is why it holds the #1 position. So let's land this with 5 things you can do starting tonight. First, go look at your nightstand and your medicine cabinet. Check for Benadryl, any PM or nighttime products, bladder medications, Amitriptyline, or Paxil. Any drug that has been running for years without a recent conversation about whether you still need it. Second, if you take multiple medications, ask your doctor or your pharmacist for a full medication review. Use the words anticholinergic burden. Write them on a piece of paper if you need to. Your pharmacist at CVS or Walgreens can often do this faster than your primary care doctor can squeeze you in. Third, if you've noticed brain fog, memory slips, or difficulty concentrating after starting a new medication, do not chalk it up to age. That assumption costs people years they don't get back. Fourth, if you have a family member in a nursing facility or assisted living, ask what they're taking. Ask specifically about quetiapine, risperidone, and olanzapine. Ask why each one was started and whether it's still necessary. Fifth, share this video with someone who takes a handful of pills every morning without knowing exactly why. They may need this information more than you do. The insurance system profits from complexity, not from simplicity. The pharmaceutical industry doesn't send you a bill for the cognitive decline it helped create. Your primary care doctor with 2,000 patients and a 7-minute appointment slot doesn't always have time to audit everything you're taking. That's why this channel exists, to give you the information before you need it. Now I want to hear from you. How old are you and what state are you watching from? Drop it in the comments. I want to see where this is reaching, from California to Florida, from Texas to New York, from the Midwest to the coast. And tell me, of these 9 medications, which ones are currently in your medicine cabinet? Have you noticed fog or forgetfulness after starting something new? Your comment might be the thing that connects the dots for someone else who reads it. If this video helped you, subscribe right here to the Dr. Weston channel and hit that like. We are walking toward 10,000 subscribers, real people who deserve honest answers about what's happening inside their own bodies. It takes 5 seconds and it genuinely matters. I'm Dr. Weston. Stay sharp. I'll see you in the next one.